While a child who presents to you with clubfoot may be diagnosed as having clubfoot, but it's also important to understand that clubfoot can be of different types. The most common that we see is idiopathic clubfoot. If you were to classify clubfeet that present to you, they'll fall into two different categories of classification. One is based on etiology, and that is what we call as the idiopathic clubfoot. Falls when you don't find any etiology, no other underlying pathology, and you have a child born with that particular deformity. It could be secondary to a primary problem, and that could be spina bifida with a neurological deficit, or any other neurological deficit that contributes to a muscle imbalance leading on to a deformed position of the foot. That's the other type. There's a third category where it is part of a syndrome. It is associated with some syndrome, and this is a component of that. The importance of this is the outcome of treatment is different from each of these conditions, and the intervention that is required may vary. Clubfoot can also be classified based on the treatment that is given. For example, a child that has treated and corrected clubfoot, a child that is untreated clubfoot. Earlier, the expression that used to be commonly used was neglected clubfoot. We no longer like to use the term neglected, as neglect word has a connotation of negativity with it. Who neglected it? Did the child's parents neglect it? Did their grandparents neglect it? Did the community health worker neglect it? Did the healthcare worker neglect it? Did the healthcare system neglect it? Did the health minister neglect it? Or did the government neglect it? Who neglected it? We do not want to assign blames to this activity, and therefore we want to just call it treated or untreated clubfoot. There is a third group which is recurrent clubfoot. So it could be treated and recurred deformity of clubfoot. So we have different categories based on treatment. Whenever a child comes to you, your job is to ensure that your assessment of the child is able to tell you whether it is an idiopathic clubfoot or any other variety of clubfoot. That's very important. So the child should have a thorough clinical examination. The important thing that we look for, are there any associated congenital anomalies? If yes, document them. Most commonly, you must look at the spine. Spina bifida. Look at telltale marks or spina bifida. There could be a surgical scar, there could be a patch of hair, not just in the lumbar spine, but in the dorsal spine and the cervical dorsal spine also. Is there any associated deformity in the knee? Is there any associated deformity in the hands? Is there any associated deformity in the hip? Specifically look for DDH. As orthopedic surgeons, one of the most commonly missed areas is the abdomen. We don't look at these children's abdomen, and many of them have what is known as umbilical hernia. So if you look for it, you will find it. Among the secondary clubfeet and associated syndromic clubfeet that you see, an important part is what is Streeter's dysplasia and arthrogryposis multiplex congenita, was renamed as multiple congenital contractures, but the AMC or arthrogryposis is a common name. We need to recognize them by looking at the pattern of deformities, multiple deformities, or in Streeter's dysplasia or congenital constriction band syndrome, the amputations that are there or the constriction bands that are there. There is a variety where Dr. Shafiq Pirani described as complex clubfeet. The term has been used by Ponseti himself for a completely different set of conditions. Any clubfoot treated, operated or manipulated by any method other than Ponseti was broadly grouped as complex clubfeet. However, there is another variety which Ponseti named as complex clubfoot, also called as atypical clubfoot, where after treatment the foot becomes shorter with a deep crease in the plantar surface with short cocked up great toe and deep creases where the correction fails to happen with Ponsonby's method. These are called atypical or complex club feet, and they need to be treated differently. The recurrent club feet need management, as I mentioned before, by specific method of tendon transfers and bracing.